Hi, my name is Dr. Mark Allen-Derry, and I'm an infectious diseases specialist in New Orleans.
Hi, my name is Doc Griggs, and I'm a community medicine doctor and health literacy expert. This is the Noise Filter Podcast, where an infectious diseases physician,
That's me, and a health literacy and communications expert,
that's me, talk about what you need to know about COVID-19.
You can find more information about this show and our other daily live updates and Q&A show at noisefiltershow.com.
So let's get started.
COVID and RSV on the rise in children. There has been a steady rise of COVID cases and hospitalizations in children as the Delta variant does not discriminate based on age. Unfortunately, there is another troubling situation on the rise: a surge of children diagnosed with a combination of COVID-19 and the respiratory syncytial virus known as RSV. According to NPR, pediatric hospitals in Texas and around the country are reporting unseasonably early outbreaks of RSV, as infections typically occur in the late fall, winter, and early spring. RSV is a respiratory virus that mostly manifests as mild illness with cold-like symptoms in adults, but can cause pneumonia and bronchiolitis in very young children. The CDC reports it can be life-threatening in infants and young adults. Recently, at Texas Children's Hospital in Houston, 25 of 45 hospitalized pediatric patients were diagnosed with RSV as well as COVID-19. Officials report that the hospitalization rate is much higher than for either virus alone. At the moment, there is little data available on the impact of contracting both viruses and whether the two together can make a person sicker. But health officials worry it could put young patients who are not yet eligible for the vaccine at greater risk. Dr. Pia Panaraj, an infectious disease specialist at Children's Hospital in Los Angeles, said, "Last year, during all of the COVID-19 outbreaks and all of our social restriction measures, we did not see RSV as the way we normally see it. The absence of widespread RSV last season means that babies up until a year and a half or 2 years of life are at risk. And the meaning behind that is because they don't have antibodies for RSV." She also explained that parents and doctors will have to be extra vigilant for symptoms, including coughing, lack of appetite, and excessive sleeping and lethargy. They can also suddenly stop breathing. In addition, the symptoms of RSV are similar to those of COVID-19, so parents and physicians need to look out for both of these infections. One bright spot in this story is that experts believe health officials will see a decline in RSV infections in places that are renewing indoor mask mandates and social distancing. We can make a huge difference in the level of viruses circulating if we all do our part to protect children and get vaccinated, socially distance, and wear masks. COVID-19 and young children. In the beginning of the pandemic, the general thought was that children were less likely to spread the coronavirus than adults. As the pandemic has lingered on, researchers have had a chance to gather data, and this has proven to not be true. In fact, research shows that the younger the child is, they are more likely to spread the virus. In a study published in the Journal of the American Medical Association and reported by ABC News, young children may be more likely to transmit the coronavirus compared with older children. Specifically, children 3 or younger were more likely to spread the virus to household members compared to those aged between 14 and 17. The study analyzed 2020 public health data from Ontario, Canada, to identify COVID clusters in which a country was the primary case within households. Data was collected prior to the emergence of the Delta variant, so more research is needed to understand transmission risk in the context of this variant. The study also took place prior to vaccines being available, meaning all household members were unvaccinated. One of the largest takeaways from the study is that it updates our understanding of COVID transmission risk. In the beginning of the pandemic, experts say it was likely assumed children didn't transmit the virus as much as adults because lockdowns and social distancing meant young children had few social encounters. But Dr. Edith Sanchez, a primary care pediatrician and assistant professor of pediatrics at Columbia University Irving Medical Center, said, "We always knew children could get it, could transmit it, and could get sick from COVID. And I think we're learning more and more of just how much." The good news is that the risk of death and severe illness is still much lower in young children compared with older children and adults. And yes, indeed, that is good news. Vaccine cards are impractically sized. For many Americans, it's become more and more necessary to carry a record of COVID-19 vaccinations with them while on the run. Many workplaces and colleges have mandated vaccine or required routine testing of the virus. The city of New Orleans has even required proof of vaccination or a negative test to enter restaurants or bars. Because they've become a significant part of daily life, an article in The Atlantic poses an important question. Why are those cards such an inconvenient size? The cards are too large to fit easily into a wallet. They're too small and routinely necessary to be stored with records like birth certificates. The Atlantic says this impracticality is symptomatic of a generally decentralized, impractical approach to keeping record of the countries inoculated. There's no national database to keep track of these inoculations. Instead, the federal government keeps tabs of vaccines reporting at the state level, which results in an incredibly variable data. In fact, there's a chance the cards weren't meant to be used as proof of vaccination at all. The vaccine card template was originally accessible on many state government health sites, and currently it's still on Florida's state website. While one state said they've done it to make it easier for local vaccine providers to make the cards, it also makes it easier to print fraudulent ones. One professor at the University of Pennsylvania said that a better system for documenting vaccination would have been 2 documents, a large document that included follow-up appointment dates and information about side effects, and a plastic wallet-sized card. Some states have attempted to supplement this inadequate documentation system by creating smartphone apps or other digital documentation systems for the vaccine. New York City created an app for verification that still has some bugs, and the state of Louisiana integrated a COVID verification feature into LA Wallet, their digital driver's license app. And this is what we're using here in New Orleans. Is we're really encouraging folks to download that LA Wallet, Louisiana Wallet. Again, even if you don't use the digital driver's license app, which has a fee, I think, of like $5 to be able to use that app, they are allowing you to download the app, and it has your vaccination status there, and that is actually free of charge. And as a musician here in New Orleans who plays in bars and nightclubs, it's very, very, very refreshing and good to know that everybody that's there in the club has been vaccinated and is also wearing masks. So these mask and vaccine mandates are great with respect to being able to help stem the cases, especially with what we saw with this incredible Delta surge here in New Orleans. And so, yes, I don't think that those cards were really meant to be proof of anything except that you got them done. I will say this. I was taking care of a patient in the hospital, and he was completely vaccinated, but he was elderly with multiple comorbidities, and he proudly walked around with his laminated vaccine card around his neck to show everybody that he'd been vaccinated. And I asked him if he was just doing that just in the hospital. And he said, no, he wore it everywhere he went. He'd been vaccinated in April and wore that laminated card around his neck everywhere he went. He was very proud of it. And it was a pleasure to be his physician while he was in the hospital.
Just as a reminder that COVID-19 and the human immunodeficiency virus do share the same risk factors. Doc Griggs?
Thanks for listening to the Noise Filter Daily Podcast. Dr. Derry and I have a daily show at 4 p.m. Central Standard Time where we go into more detail on stories and answer your questions about COVID-19.
You can find Doc Griggs at DocGriggs1 on social media, and you can find me at Dr. Mark Allen Derry or at DRDERY. You can follow us at Noise Filter on Instagram, Noise Filter NOLA on Twitter, and for more information about us and the show, you can go to noisefiltershow.com. Hey, Doc Griggs, any last words?
Remember, get checked, get fit, get moving. And remember to get some rest to boost your immune system. And Doc?
Protect yourself and others by staying home, and please wear masks when you go outside. Remember, health is a human right.